Hello guys, today we are going to discuss about the mandible. If you are new in this channel, so please subscribe my YouTube channel. Mandible. Now mandible is the largest and strongest bone of the skull, and it is the only movable bone of the skull, and it has one body and two ramus. And this is the body, and this is the body, and this is the ramus. Now body has two surface and two border. This is the external surface and our outer surface, and this is the inner surface or internal surface, and two border. This is the upper border or alveolar border, and this is the lower border base of the mandible. Now ramus has two surface and four border. This is the surface, lateral surface, and this is the medial surface. This is the medial surface and four border. This is the anterior border of the ramus, and this is the upper border, and this is the posterior border, and this is the lower border, and it has one angle. This is the angle of the mandible. This is the angle of the mandible. Now process, there is two process. This is the conoid process, this is the conoid process, and this is the condylar process. This is the condylar process. Now the external surface of the body. This is the external surface of the body. So it has a symphysis menti, and that is it indicate the fusion of the two half of the mandibles. This symphysis menti also indicate the fusion of the two half of the mandibles. Now this is the below this symphysis menti, there is a one elevation, that is a mental protuberance. This is the mental protuberance, and then on each side of the mental protuberance, that is a mental tubercle. This is a mental tubercle. On each side of the mental protuberance, there is a mental tubercle. There is a depression on both sides of the mental protuberance. This is a mental protuberance, and there is a depression on both sides of the mental protuberance. Below the incisor teeth, this is the incisor fossa. This is the incisor fossa, and which provide attachment, that is mentalis, and then sleeve of the orbicularis oris. Now external surface is present of foramen. This is the mental foramen. It found in the adult. In adult, it found midway between the upper border or alveolar border and base of the mandibles, and then between the premolar teeth. Now importance of this foramen, this is a injection is given for the nerve block during the dental surgery, and it is also important for the age determination. Mental foramen transmit the mental nerves and basal. Now the oblique line. In oblique line extend from the mental tubercle to the upward and backward, up to the anterior border of the ramus, at the junction of the body of the mandible and the ramus. External surface below this oblique line. It's crossed by the upward and forward by the facial artery, and facial veins, and mandibular branch of the facial nerves. Now the internal surface. This is the internal surface. Has in symphysis menti, there is a four tubercles, so two upper tubercle and two lower tubercle. Upper tubercle, that is upper genial tubercle, two upper genial tubercle and two lower genial tubercle. Two upper genial tubercle and two lower genial tubercle, and two upper genial tubercle, that is genioglosser, and then two lower tubercle, then geniohyoid. Provide geniohyoid attachment. Yes. Then mylohyoid feature of the internal surface, that is mylohyoid line. This is mylohyoid line. It extend mylohyoid line. It extend upward and backward direction. Upward from the lower part of the symphysis menti. The symphysis menti extend upward and backward from the lower part of the symphysis menti to the inner surface of the alveolar border. This is the alveolar border, inner surface of the alveolar border, just below the third molar teeth. Now it divide the inner surface into the upper mandibular fossa, upper sublingual fossa, and lower submandibular fossa. Now this line provide attachment, that is mylohyoid muscle. This line provide attachment, that is mylohyoid muscles. Yes. Now this above the mylohyoid line, this is sublingual fossa. Sublingual fossa contain the sublingual gland, and then below the mylohyoid line. This is the submandibular fossa. This submandibular fossa and submandibular fossa contain the submandibular gland. Now group, this is the mylohyoid group. Mylohyoid group, it extended downward and forward from the ramus of the mandible to the posterior part of the submandibular fossa. Posterior part of the submandibular fossa. Yes, this is submandibular fossa. Now this group, mylohyoid group, contain the mylohyoid vessels and nerves. The area behind the third molar, the area behind the third molar attachment to the pterygomandibular raphe. Now, behind the third molar to the attachment to the lower end of the pterygomandibular raphe. This, and now the ramus of the mandible, yes, and then it has two surface, one medial surface. This is the medial surface, and one is lateral surface, and four border. This is the upper border. This is the upper border. And this is the lower border, and this is the anterior border, and this is the posterior border, and two process, one coronoid process, one condylar process. Ramus contain the mandibular foramen. This is the mandibular foramen. Ramus contain the mandibular foramen. This is the mandibular foramen. From through its inferior alveolar nerves and vessel is passes. From mandibular foramen, inferior alveolar nerves and vessel is passes. Now, surface, and this is the lateral surface or external surface. Lateral surface. Lateral surface provide attachment to the master muscles in most of the part. This is lateral surface provide attachment to the master muscles in most of the part, except the posterior superior part, where it is covered by the parotid gland. Now the medial surface or inner surface. There is a mandibular foramen. This is a mandibular foramen. And through its mandibular foramen, there is a inferior alveolar nerves and vessel is passes. From mandibular foramen, inferior alveolar nerves and vessel is passes. And this is the lingula. Which it is a tongue-like projection which overlap the mandibular foramen. This is the lingula, which is tongue-like projection which overlap the mandibular foramen. This lingula provide attachment to the sphenomandibular ligament. Now the border, anterior border. Now this is the anterior border. This anterior border is thin and continuation with the coronoid process. Anterior border is thin and continuous with the coronoid process. Now posterior border is extended from the condylar process to the angle of the mandible. This is the angle of the mandible, and it extends from the condylar process to the angle of the mandible, and it is thick posteriorly. Here it is thick. Now the upper border. This is the upper border. It extends from the coronoid to the condylar process and present a notch. That is mandibular notch. This is the mandibular notch. Mandibular notch transmits the mastic vessels and nerves. Now the lower border. Lower border is continuous with the base of the mandible. Yes. This is the lower border. Lower border is continuous with the base of the mandible. This is condylar process. Yes. This condylar process head and the neck, and the head is articulated with the mandible fossa of the temporal bone and form the temporal mandibular joint. And the neck is attached to the lateral pterygoid muscle. Neck is attached by the lateral pterygoid muscles. Now the coronoid process. This is the coronoid process, and coronoid somewhat it is a triangular. Coronoid somewhat is a triangular, and anterior and the medial surface. Anterior border and the medial surface. Anterior border and the medial surface. Provide attachment, that is, and temporalis muscles. Anterior border of the coronoid process and the medial surface provide attachment to the temporalis muscles. Now the angle. This is the angle of the mandible in case of the male and in case of the female. In case of the male, angle of the mandible, in case of the male it is everted, and in case of the female it is inverted. And this angle of the mandible in case of the adult and in case of the old age. In case of the adult and in case of the old age. In case of the adult, it is 110 to 115 degree. In case of the adult, and in case of the old age, it is 140 degree.